afternoon, all of you. Good afternoon. I hope that all are awake. And now it is good evening. We are at the verge of good evening. So I am very happy and very immense pleasure to be on this great platform. At the onset, first I should say a great thanks to the team of Engage and the team of Hamai. I am very sorry that today you will say that my voice is breaking, and this all credit goes to Bhaskar sir and Ketan sir. Yesterday we had a great that is why I am speaking here, sir, because I didn't get the chocolate ice cream. From my bottom of heart, I first thank my sir, Dr. Ajit Kulkarni sir, who is an instrumental for me to bring here in this platform and to introduce the great master of Engage, none other than, you all know, Vishpala madam. When I was doing my post-graduation, sir introduced me to her and the journey began. She gave such faith on me that just on one say of Dr. Ajit Kulkarni sir, that give the responsibility to Vaishali, she will take over Pune. I hope, ma'am, I did it. And whatever said since in the morning about ma'am, I have experienced it. I had no one in Mumbai to stay over. She said, don't worry Vaishali, you just come over. I stayed with her. Anytime, whenever I go to Mumbai for SSMS, I stay with her. And I see the love, the appreciation, the care of her towards each and every person, right from the lower to the higher. So I owe this platform, ma'am, to you. I am so happy and I am so blessed to be here in this platform. May you live long, 100 years. This is my. So I go ahead with the presentation, and this is what is Gujarat. I came to Gujarat for the first time, and this is Cape Cho. Am I right? Yes. So I'm really excited to see Gujarat students, and I was told that there are so many interns over here and more of the students, and since morning we are going to see an approaches. All the approaches, all the well said homeopathy, organ of medicine, repertory, we are going to unfold this in this platform, and every year it goes huge by unfolding so many cases in front of you, and you are going to learn each and every case in detail in the Journal of Homeopathy, that is National Journal of Homeopathy. So in the beginning only I am going to tell you that see, all the cases are there in the journal. You are supposed to be a life member and a subscriber. So I promised Munira that after my lecture you will have a busy schedule over there, so that all my students who are here, all my interns who are here are going to have their lifetime subscription of Engage, or at least a subscriber. So you promise me here? Yes, all of you are promising? Students, after this lecture you will, as an academician, not as a vice principal over here, but as a teacher of anatomy, you are going to find this presentation of mine into an insight of what anatomy, what clinical knowledge of ours as anatomy and physiology goes hand in hand. Our clinical diagnosis, our disease diagnosis is going to go hand in hand, and the application of this to our homeopathic practice. We are going to go ahead. We all are homeopaths over here, and the girl homeopath, as ma'am has given the responsibility to us, me as a lady homeopath. Ma'am, I am promising here again that I see more female homeopaths, and these female homeopaths will be here on the dais in the next visit of SSMS. Yes? Good. So, Cape Cho again, pajama? So, no pajama, but this topic is very hard. I know that brain, the central nervous system, when we enter into the CNS, it becomes an enigma to us to learn the whole central nervous system and the brain in detail. But you all know that when we are going into the brain functioning and the anatomy of it and understanding the detailings of the sulcis and the gyres, and we are knowing each and every aspect of the brain along with its hypothalamus, the hippocampus, the amygdala, all these things in the brain aspect. Though it is an enigma, since yet the whole aspect of brain is not known, but our system of health and disease is much based on the balanced system of our PNE axis. What is happening inside the brain is not seen by us, but monitored, but understood very well with our recent investigations. All the advanced investigations, 3D MRI, 4D MRI, and more latest what is coming, we are going to find out the integral part of it. What is happening inside the tissue, inside the cell? Yes, we are. But when we are having an improvement in it with homeopathy, with the signs and symptoms which we elicit, so by taking our case taking 2 hours, and when we see that yes, this is an evidence-based that I have cured. Again, I am very afraid to take the word cured, sir, so I have not added permanent over here, otherwise you will say 63.37% pure false. But this case which is unfolded for me gave me an insight that what is needed for the students and my future budding homeopaths. What are they? Are they in dilemma of practicing homeopathy? Or now as a new rule for the NCH which have come with modern pharmacology and we are shifting. I don't want this lateral shifting or drifting ourselves as a homeopath into another pathy. Yes, we know it, we have the sincerity of it, clarity of it, and of course it is the pathy. But the confidence level which you are going to grow up is with evidence-based, and what and when and how, what to do. So we go ahead with the case. My case is migraine with epilepsy, and I'm sure this PCA, Vaishali didn't want to put it on the floor here. She said, ma'am, it is too big, but what is PCA? Yes, anybody? Students? As an academician, see, I have got to ask questions more because in my lecture hall I ask, yes, students, PCA? Anyone in this corner? खाना बहुत हो गया मीठा, so मजे में. So it is patient-centric approach. So here we are going to approach is patient-centric. So if you are into PCA, you are into homeopathy, you are into evidence-based pathy, and you are into the root of success. So what is epilepsy? You all know that they are the conditions which come into patients who have epilepsy and seizures. I am not going into the detailings about it and going to the case directly. So this is a boy. So as you can see the black and white and zigzag movements of this boy, and yelling part is the same boy who has been treated with epilepsy. Now how he is treated with epilepsy, we will see. The boy, 19 years old, with a nosological diagnosis of epilepsy with migraine. And epilepsy, which you all know, is a central nervous system neurological disorder which has seizures, and anyone can develop epilepsy. A migraine is a headache that can cause severe throbbing pain or pulsating sensation, usually on one side. Now a lot of it said, so we will enter into the case. This case is of 19 years old male. He was a known case of hypothyroidism with migraine, and he was on regular medications on anti-epileptic drugs. He was also taking Thyronorm as a hypothyroid medicine. His epilepsy was since 2015, and his mother had come to me with no investigations at all. Believe me, she had come to me with only knowing that such and such doctor is very famous for treating epilepsy, and she came with all the reports which she had, all the MRIs, all the big files she had. She literally threw it away because that boy was not getting cured by so many anti-epileptic drugs. It was seizure. You imagine that a boy of your own is getting seizures and falling down, quitting the classes, coming back to home with so much of disability to survive. See what happens to the mother. So the mother is not at all comfortable with all other antibiotic remedies. So she came to me with great hope that, madam, now at least you see that I've heard of you. ये लड़का आपके हवाले. So I took the case, and the detailings of the case again I am going to put it on JH. You are going to read the detailings, case taking and case management and the case repertorization. Here I am going to have a very short time, so only 20 minutes ma'am is given. So I am going to go to the crux of what I did. So every intern, every student should know that yes, what are our approaches and what we have to think about the case. So this boy had, the history goes that he had the maximum seizure freedom for 2 years. Then the history of febrile seizure but no tongue bite. His birth history and the delivery history were normal. Father had nephrotic syndrome. He too suffered with nephrotic syndrome. He studied till 9th, and there was little disability of left hand, but the right hand had no deficit. So he left schooling. He was at home, and what to do now? So these are the drugs which he was on. So taking the detailing case history, and as here in this slide you can see that only the totality of symptom is shown. The symptoms define him as dreams of misfortune. He used to dream so much that he will not survive, he will not go ahead, his studies are not there now, how are you going to survive?
5 minutes.
He had propensity to be destructive, bite, strike, tear, delusions, imaginations, people somewhat behind, contradiction, ailments from convergence, periodic headache and fear of drug. With this, the drug is very much clear. Yes? Which drug? Belladonna. You can see belladonna is coming in the highest. We have taken the rubrics. I am not going into the detailings. How did belladonna differ with other medicines, other similar with us? So we have stramonium, which is absolutely painless. When stramonium comes, painless should be there. Merc salt, there should be destructive. He was destructive. You might be feeling, but who was destructive? Mother was destructive. But by spoiling the files, not him. He was not destructive at all. Merc salt is very angry and irritable, and they would beat themselves. Lycopodium, the boy was well-to-do, hearty, so it's the Pundi boys didn't come in the picture. Vinatropalpum, with epileptic seizures, you go cold and collapse. Hyoscyamus will have Nasir's mania. Now belladonna was given, and now from here the case starts to think, what is our thought process? So when I saw that the boy was very happy, mother was happy. Mother said that the boy slept nicely at night. He closed off the light also and he went to sleep. I am so happy, ma'am, he's cured. But then he had an episode of seizure, and here I striked that no, with the seizure, I do not continue the treatment. There is something more in the amygdala and the hippocampus that the trigger, the emotion, the seed of emotion lies here, and this is triggering, and this case is not mine. I referred this case to neurosurgeon, and he took the case, he went for an MRI immediately. This was only for 5 weeks time. First week he came, I gave belladonna, he got fever, he got better. Again I reviewed, he got an episode. I thought no, he has to go to a neurosurgeon. Neurosurgeon rightly diagnosed. He underwent right temporal lobectomy. Now see, this is an acute case or chronic case. See, this is a surgical case or non-surgical. It is curable or non-curable. So we understand the whole spectrum of disease classification over here and take a decision. So he was rightly managed by the neurosurgeon, and look what he is saying.
Epilepsy in all pathies, because it is a disorder which should be recognized and correctly identified by all the branches of medicine like allopathy, homeopathy, and as well as Ayurvedic medicine. This 19-year-old boy who was referred to me by Bhagat madam, who had epilepsy of 4 years duration, he used to have seizures characterized by, he used to have aura, where he used to have some fear sensation, something rising from the stomach going up, and then he used to hug somebody who is nearby, followed by, then there was a face and eye deviation to the one side, and sometimes he used to have generalized seizure. To start with, it was 1 or 2 per day. Then with the starting medications, it became 1 per week, but it does not stop completely. He was started on anti-seizure medication. When I saw him, he was on 3 anti-seizure medications. In addition, he had a migraine and he had behavioral issues also. He was initially managed by Bhagat madam, and when she thought that he is not improving at all with the homeopathic medication as well as other allopathic medications, she referred him to me for correct identification and management of his epilepsy.
1 minute left.
18, he was on 3 antiepileptic medications as well as medication for his migraine. What we did, we evaluated him, we have done his video EEG, recorded his seizures, what type of seizures he had. Then we done his MRI and PET scan of the brain for identifying the focus from where the seizures were coming. As Madam rightly thought that he is a surgical candidate, we identified the focus on the right side and we removed his right hippocampus amygdala as well as the temporal lobe, which was affected and proven by the EEG, MRI as well as the PET scan. After surgery, over the 2-year period, we slowly reduced his drug and we stopped his drug. So last 3 years, he is drug free. For migraine, he is also having reduced attack, and now the correct referral by identifying this is a surgical case is the most important thing, and patient's centric behavior of the physician is important. Identifying what the patient needs and referring at correct time is important, which was done by Bhagat madam, and he was referred to us. Now he 5 years completed after surgery, and for last 3 years he is drug free as well as a seizure free. So that is the important point, to make aware that to do correct referral, don't say that this path is patient or that path is patient, and identify whether we can treat him with that point or we have to refer it to somebody. I again thank Dr. Bhagat for timely referral and making this person, because the credit goes to the correct referral person, otherwise he would have just kept on wandering here and there. So credit goes to her, making him seizure free and drug free. And
Time up actually. Just wind up.
So we understood that each case we have to take holistically. We have to accept our limitations and scope of homeopathy. There we are going to go ahead. In the contemporary practice, we have to have our full evidence-based pathy. Our confidence level on this goes ahead, and we are through a patient-centric approach. Keeping patient realistic goals for rapid, gentle, not permanent cures are here. Have sound knowledge of medicine, right referral, right time, bring life back to the sick individual. Aim to cure sometimes, to relieve often, and to comfort always. May homeopath flourish and grow from strength to strength. Thank you, Gujarat, NJH and Hamal, viewers and audience for patiently hearing me. Long live homeopathy. That was an